Poultry medicine. The etiology, diagnosis, treatment, and prevention of avian influenza.
Welcome to the Veterinary channel. Today we will discuss one of the most important diseases in poultry called as avian influenza. In this tutorial we will discuss introduction, etiology, clinical findings, treatment and prevention of avian influenza. Introduction. Avian influenza is a viral influenza of birds including chicken, turkey, guinea fowl and other species. Symptoms may vary in severity from asymptomatic to mild respiratory and reproductive disease, highly fatal and systemic disease. Etiology. Avian influenza viruses are negative-sense single-stranded RNA virus in the family Orthomyxoviridae genus Influenza A. It is also called as Influenza A virus or type A influenza virus. It is further categorized into hemagglutinin and neuraminidase subtypes. Clinical findings. Clinical signs, severity of the disease, and mortality rates vary depending on avian influenza virus strain and host species. Low pathogenic avian influenza viruses. Respiratory signs such as sneezing, coughing, ocular and nasal discharge, swollen infraorbital sinuses in poultry. Highly pathogenic avian influenza viruses, systemic disease with high mortality in chickens, turkeys, and poultry. In paracute cases, clinical signs or gross lesions may be lacking before death. In acute cases, cyanosis and edema of the head, comb, wattle, and snout, blood-stained oral and nasal discharges. Diagnosis. Low pathogenic and high pathogenic avian influenza viruses can be readily isolated from oropharyngeal and cloacal swabs. Influenza viruses grow well in the intact sac of 9 to 11-day-old embryonic chicken eggs and they agglutinate RBCs. Incubating influenza viruses in the intact sac of 9 to 11-day-old embryonic chicken eggs and they agglutinate RBCs. Another diagnostic method is the PCR. Real-time reverse transcript test PCR is the preferred diagnostic test which gives result just only in 3 hours. For the treatment of avian influenza viruses, the drugs include amantadine, rimantadine, and neuraminidase inhibitors. Prevention of avian influenza. Destroying birds carrying or suspected of carrying the virus. Disinfecting farm equipment, clothing, and boots. Limiting, restricting, or banning the shipment of live birds within and between the country that have blood flu epidemics. According to the latest research report by World Organization for Animal Health, avian influenza viruses can't be transmitted through eating poultry products, but be sure to always clean and cook poultry products before consumption.
Poultry medicine. The etiology, diagnosis, treatment, and prevention of avian influenza.